Well, there's been a lot of criticism around the approach the UK has taken to keep children safe in schools, and that's because very little mitigation measures have been put in place. So there has been no requirements for improved ventilation, no use of air purifiers, et cetera, things like HEPA filters, which we do see being used in the United States in places like New York. Also, there have been all restrictions removed around the need for wearing face masks indoors. And that has really been left to individual employees and organizations to decide for themselves whether they will continue with layered protection or not. So again, there's a lot of discrepancy about how institutions might operate in this particular phase of the pandemic, particularly as the vaccine in the UK has not been made available for 12 to 15-year-olds or those under 12 as well, unlike many other countries. So if we look at Canada, the US, Israel, Japan, other European nations. So we will see in September, there's a bit of this winging it approach in terms of no mitigation measures and no access to vaccine.
Not even testing? The children won't need to be tested? And do you think that would be an effective tool using swab tests?
Well, swab tests aren't perfect. We know that they aren't the most accurate, but if we continue with weekly testing, that will help to catch cases quickly. However, in response to many students, almost entire classes, having to isolate and bubbles falling apart, the UK government is sort of pushing forward with a no rules or restrictions approach. So the need for testing is clear, at least at a weekly basis.
And you mentioned vaccines as well. Why are UK public health officials reluctant or being particularly cautious in recommending the vaccine for children?
So in the UK, the JCVI is the committee that decides, puts forward the recommendations. So the MHRA has approved the use of these vaccines in teens, and they have said that they are taking this decision out of an abundance of caution. It's really a wait and see approach, but in the meantime, we know that this delay doesn't come without cost. There has been, in terms of cases linked to long COVID, since June 4th, about between 9,000 to 18,000 cases, 9,000 to 18,000 cases of kids that have had complications, and over 1,000 hospitalizations just from June alone. So there is a clear cost to kids if adults don't act responsibly on ensuring access. So a decision is being discussed, and NHS England has been told to prepare for that eventuality, but that is just at a planning stage. So there is no confirmation that this age group will be eligible in the UK for these vaccines.
And taking all of these factors into consideration, how do you think the COVID cases and hospitalisation numbers will fare in the coming months?
So we do risk seeing a back-to-school surge. We certainly saw that with the Delta wave in the United States. There had been an increase in the number of pediatric ICU admissions. In the UK, that trend has not been as mirrored, but we do know that because there is a large proportion of the population that, at least in terms of the non-adult population that hasn't been vaccinated, this can cause pressure on the wider health system, because we already have seen a 10 times increase in hospitalizations at the same time this year than last year. So cases are holding up steady, about 37,000 cases a day. Hospitalization rates are high. And we're going to see return from travel, coming back to school, all at the same time. So this is something that, again, will be a crunch period when it looks to how it will spread across the country.
Meanwhile, let's turn our attention to the US. I'm interested to hear your thoughts on the US planning to administer booster shots for those who were already vaccinated. Given so many in other countries haven't even received their first or second doses, like the WHO points out, what do you make of that?
Well, I agree with the WHO, and they've called for a moratorium on all booster shots, for at least to get at least 10% of other low-income countries to get their very first dose. We know that the vaccine is doing its job in terms of preventing severe disease and hospitalizations. However, with Delta, there is more transmissibility risk. So it is a bit of a knee-jerk reaction to be at this stage so early, 6 months after the last dose, being offering another jab. I think maybe there could be a need for it down the line, but the priority really should be for other countries, the majority of the world, to get their first dose, because these are often very highly populated areas in very densely populated regions. So it's sort of these perfect conditions for, with very high transmission, for other variants that could be worse than Delta to emerge. So we're really boosting the chances of a virus developing a new variant by giving booster jabs, rather than offering layered protection. So again, looking at, for people who are at more risk, who could benefit for additional protection, even with 2 jabs, to still be using face masks and taking other precautions. So I would agree with the WHO that I think that at this stage we need to be boosting global production, ensure that there's enough vaccine being made. And there could be other treatments available, monoclonal antibodies, et cetera, for those that need a top up on their immune response. But on the whole, I think it's too early. The studies there are just not strong enough. The evidence isn't strong enough to really support this policy. It's a just in case policy rather than something that confers immediate benefit and need.
Oksana Pyzik, great to get your thoughts. Thank you so much.
Thank you.